Pharynx, which allows both air and food to pass through it, is divided into nasopharynx, oropharynx, and laryngopharynx. One of the important vertebral landmarks to remember in pharynx is the C6 vertebral level. C6 is the vertebra at which pharynx continues as the esophagus. Pharynx is made up of muscles, mainly two groups of muscles, longitudinal group of muscle and circular group of muscles. The longitudinal group of muscle are oriented vertically. The circular group of muscles are oriented in a circular fashion encircling the pharynx. The longitudinal group of muscle include stylopharynges, salpingopharynges, and palatopharynges. The circular group of muscle include superior constrictor, middle constrictor, and inferior constrictor. These circular group of muscles are arranged one above the other, like the petals of a flower. So this kind of arrangement creates gaps between the muscles. One of the important gaps I want to highlight is a gap between the superior constrictor and middle constrictor muscles. These gaps allow some vital structures to pass through it. So the gap between superior and middle constrictor muscle allows the stylopharyngeus muscle to pass through it. Clear? Now stylopharyngeus muscle is an exceptional muscle of the pharynx. It is the only muscle that is supplied by the glossopharyngeal nerve. The rest of the muscles are supplied by the vagus nerve. Okay. We understood that there are gaps between the muscles, and each gap allows certain important structures to pass through it. What is really important to remember is the gap between superior and middle constrictor not only allows the stylopharyngeus muscle but also the glossopharyngeal nerve, which is supplying the muscle itself. Among all the muscles of the pharynx, I urge you to remember only one muscle that has a significant clinical relevance, and that muscle is the inferior constrictor muscle. The inferior constrictor muscle has two different components. One is the oblique fibers, which is known as the thyropharyngeus. Another one is the horizontal fibers, which is known as the cricopharyngeus. There is a gap between these two fibers, and the gap is known as the Killian distance. So it creates a potential weakness in the posterior wall of the pharynx. This weakness leads to prolapse of mucosa and submucosa, sometimes leading to a pouch or diverticulum that is known as the Jenkins diverticulum. These are lymphoid tissues around the aerodigestive system in the nasopharynx and the oropharynx. They are arranged in a ring shape, that is why they are known as component of Walder's ring. There are usually four grooves, two in the nasopharynx, two in the oropharynx. In the nasopharynx, nasopharyngeal tonsil and adenoid, tubal tonsil, and in the oropharynx, palatine tonsil and lingual tonsil. This is a 7-year-old child with mouth breathing. Her mother took her to the hospital. The physician advised one radiograph. This is the radiograph of the child. Now, what is the diagnosis? The diagnosis in this case is adenoid hypertrophy. Adenoid lies in the nasopharynx. This is the adenoid gland, which is enlarged in this case. Because of the enlargement of the adenoid, it compromises the nasopharyngeal isthmus. So that is why the child cannot able to take a nasal breath. Is breathing through the mouth. And there is a specific radiograph dedicated to identify the adenoid hypertrophy. The radiograph is soft tissue lateral view of the nasopharynx. And the facial expression of the child in case of adenoid hypertrophy is very characteristic. It's known as the adenoid faces. The face is elongated, dull looking, there is open mouth with upturned lips. Palatine tonsil is located between the palatoglossal and the palatopharyngeal arches. There are many structures that form the bed of the palatine tonsils. The most important and clinical relevant structure in the tonsillar bed is the glossopharyngeal nerve. So during tonsillectomy surgery, there is a risk to injure the glossopharyngeal nerve. Glossopharyngeal nerve has a sensory supply to the posterior one-third of the tongue, pharynx, and middle ear cavity. The efferent fibers of the gag reflex is supplied by the glossopharyngeal nerve. So injury to the glossopharyngeal nerve may lead to loss of sensory sensation in these three structures or loss of gag reflex. Now identify the anatomical structure marked by the arrow. Let us first understand the question. This is a radiological anatomy question. Let's understand the question from the source image. The image is derived from a study which is done for dysphagia. Dysphagia is usually two types, oropharyngeal dysphagia and esophageal dysphagia. For oropharyngeal dysphagia, a study is done which is known as video fluoroscopic swallow study. This is a modification of barium swallow. Barium swallow for oropharyngeal dysphagia done in two projections, lateral projection and AP projections. In both these projections, we take one filling phase and one relief phase. Coming to the radiological anatomy, this one is the hyoid bone. This is the epiglottis, which usually closes the laryngeal inlet. This one is the vallicula. This is the piriform sinus. Piriform sinus is a part of the hypopharynx which extends alongside of the larynx. Coming back to the question, this is piriform sinus. It is also known as the smuggler's fossa. It is a mucosal recess which extends alongside the larynx. One of the anatomical relations we need to remember is that piriform sinus is closely related with the internal laryngeal nerve. Why is this relevant? Sometimes foreign bodies like fish bone get stuck in the piriform sinus. So there is a risk to injury to the internal laryngeal nerve. Summary of today's learning. Pharynx is a muscular tube made up of 3 longitudinal muscles and 3 circular muscles. Stylopharyngeus muscle is the only muscle supplied by the glossopharyngeal nerve, which passes through the gap between the superior constrictor and middle constrictor muscle. Weakness between the thyropharyngeus and cricopharyngeus muscle is known as the Killian dehiscence, which may lead to formation of Jenker's diverticulum. Glossopharyngeal nerve lies in the tonsillar bed, and internal laryngeal nerve is closely related with the piriform sinus. Pharyngeal tonsil, tubal tonsil, palatine tonsil, and lingual tonsil constitute the Wilder's ring. Glossopharyngeal nerve supplies the motor to the stylopharyngeus, sensory to the posterior one third of the tongue, pharynx and middle ear cavity, and efferent fibers of the gag reflex.